Adhesive capsulitis, commonly known as frozen shoulder, is a condition that causes pain and stiffness in the shoulder joint. Over time, the joint capsule becomes thickened and tight, restricting movement and making daily activities challenging. This condition can develop gradually and may last for months or even years. Risk factors include diabetes, thyroid dysfunction, and certain autoimmune diseases. While the exact cause is often unclear, it can sometimes be triggered by trauma or injury. Understanding the basics of adhesive capsulitis is crucial before exploring treatment options, as it sets the stage for comparing different therapies aimed at relieving pain and restoring function. Traditionally, adhesive capsulitis is managed with a combination of pharmacological and non-pharmacological treatments. These include physical therapy, nonsteroidal anti-inflammatory drugs, oral and injectable corticosteroids, and sometimes more invasive procedures like manipulation under anesthesia or capsular release. The primary goals are to reduce pain and improve range of motion. However, each approach comes with its own set of benefits and potential drawbacks, especially for patients with underlying health conditions. As we move forward, let's examine how newer therapies are being compared to these established treatments. Orthobiologics represent a new class of treatments designed to harness the body's natural healing abilities. These include platelet-rich plasma, PRP, hyaluronic acid, HA, bone marrow aspirate, and stem cell therapies. The goal is to reduce pain and promote healing in musculoskeletal conditions like adhesive capsulitis. PRP and HA in particular have gained attention for their potential to improve outcomes without the side effects often associated with corticosteroids. As research grows, orthobiologics are being considered as promising alternatives or adjuncts to traditional therapies. Platelet-rich plasma, or PRP, is created by concentrating platelets from a patient's own blood. These platelets release growth factors that help reduce inflammation, stimulate tissue repair, and promote healing. When injected into the shoulder joint, PRP delivers these growth factors directly to the site of damage, encouraging collagen production and stem cell activity. This process can help reduce pain and improve function over time, making PRP an appealing option for those seeking long-term relief from adhesive capsulitis. Hyaluronic acid, HA, is a naturally occurring substance in joint fluid that lubricates and protects cartilage. In adhesive capsulitis, HA injections can help reduce inflammation by binding to specific cell receptors, which in turn decreases the production of proteins that break down the joint's extracellular matrix. This action not only helps relieve pain, but also supports joint mobility. HA is considered a safe option and is often used in combination with other treatments to maximize benefits. Corticosteroid injections are widely used to manage pain and inflammation in adhesive capsulitis. These injections provide rapid relief by suppressing the body's inflammatory response. However, they are not without risks. Side effects can include metabolic and endocrine disturbances, especially in patients with diabetes or other chronic conditions. While corticosteroids are effective in the short term, their long-term benefits are less clear, prompting researchers to explore alternatives like PRP and HA. Compare these treatments. A systematic review and meta-analysis was conducted. Researchers searched databases like PubMed and Google Scholar for studies published between 2019 and 2024. Only studies that compared PRP or HA to corticosteroids in adults with adhesive capsulitis were included. After a rigorous selection process, 6 studies were chosen for detailed analysis. The research followed PRISMA guidelines and used standardized tools to assess risk of bias and extract data. Studies used several standardized tools to measure outcomes. The Visual Analog Scale, VAS, assessed pain intensity, while the disabilities of the arm, shoulder, and hand, DASH, questionnaire, evaluated functional limitations. The Shoulder Pain and Disability Index, SPADI, measured both pain and disability, and the UCLA Shoulder Score looked at pain, function, and satisfaction. These tools provided a comprehensive view of how each treatment affected patients' pain and daily function. When looking at short-term outcomes, particularly at the 3-month mark, the studies found no significant difference between PRP and corticosteroid injections for pain relief. The pooled data showed a slight trend favoring corticosteroids, but this was not statistically significant. This suggests that both treatments are similarly effective in the early stages, but the real differences may emerge over a longer period. At 6 months, the picture changes. PRP injections demonstrated a statistically significant improvement in pain reduction compared to corticosteroids. The standardized mean difference favored PRP, indicating that patients experienced greater and more sustained pain relief over time. This long-term benefit is a key reason why PRP is gaining traction as a preferred option for managing adhesive capsulitis. Functional improvement is just as important as pain relief. The DASH scores at 3 months showed no significant difference between PRP and corticosteroids. However, at 6 months, PRP showed a statistically significant advantage, with patients reporting better arm, shoulder, and hand function. This suggests that PRP not only helps with pain, but also supports a return to normal activities over time. SPADI and UCLA shoulder scores provide further insight. At 3 months, there was no significant difference between PRP and corticosteroids in SPADI scores. However, at 6 months, the UCLA shoulder scores favored PRP, indicating better pain control and functional outcomes. These results reinforce the idea that PRP's benefits become more apparent with time, especially in terms of overall shoulder function. While PRP has shown clear long-term benefits, the comparison between hyaluronic acid, HA, and corticosteroids is less definitive. The studies reviewed found a non-significant trend favoring HA at 6 months, but the results were not statistically conclusive. This suggests that HA may offer some benefit, but more research is needed to determine its true effectiveness compared to both PRP and corticosteroids. Major challenge in this meta-analysis was the high level of heterogeneity among the included studies. Differences in study design, patient populations, treatment protocols, and outcome measures made it difficult to pool data consistently. Additionally, some studies lacked complete reporting of key statistics, which limited the strength of the conclusions. These limitations highlight the need for more standardized research in the future. Safety is a key concern when choosing a treatment. Corticosteroids, while effective, can cause side effects such as increased blood sugar, skin changes, and even tendon rupture. PRP and HA are generally considered safe, with few reported complications. However, the long-term safety of these newer treatments still requires further investigation, especially as their use becomes more widespread. Several lifestyle and procedural factors can influence the effectiveness of PRP treatment. These include blood pressure, cholesterol levels, smoking, alcohol use, and the use of certain medications. Additionally, the number of PRP injections, the injection technique, and whether ultrasound guidance is used can all impact outcomes. Future studies should account for these variables to better understand who benefits most from PRP. One of the key takeaways from this review is the urgent need for standardized research protocols. Consistent follow-up periods, uniform outcome measures, and thorough reporting of results are essential for future studies. Standardization will help reduce heterogeneity and allow for more reliable comparisons, ultimately improving patient care and guiding clinical decisions. Looking ahead, larger and more rigorous randomized controlled trials are needed to clarify the role of PRP, HA, and other orthobiologics in adhesive capsulitis. Research should focus on long-term outcomes, safety profiles, and identifying which patients are most likely to benefit. Exploring the comparative efficacy of different orthobiologics will also help refine treatment strategies for this challenging condition. For clinicians, the findings suggest that while corticosteroids remain a reasonable first-line treatment for rapid pain relief, PRP offers superior long-term benefits in pain reduction and function. HA may also have a role, but more evidence is needed. Individual patient factors, preferences, and risk profiles should guide treatment choices, with an eye toward emerging evidence and evolving best practices. In summary, this meta-analysis highlights the promising role of orthobiologics, especially PRP, in managing adhesive capsulitis. PRP provides greater long-term pain relief and functional improvement compared to corticosteroids, though short-term outcomes are similar. HA shows potential, but requires further study. The need for standardized research and careful patient selection remains paramount as the field continues to evolve. Adhesive capsulitis can be a challenging condition, but advances in orthobiologic therapies like PRP and HA offer new hope for patients seeking lasting relief. While corticosteroids are effective for quick symptom control, PRP stands out for its long-term benefits. As research continues, patients and clinicians alike can look forward to more personalized and effective treatment options for frozen shoulder.